Hello everyone, my name is Lucy. Do you have severe period pain that stops you from carrying out your daily life activities and you believe that it is normal? Please come close, because this, as you're saying it, might not be normal. It might be a condition known as endometriosis. What is endometriosis? Endometriosis is when a tissue that resembles the inner lining of the uterus, which is also known as endometrium, grows outside the uterus. It is known as endometriosis. Why does it cause harm? It is because it always acts as the endometrium should do by reacting to hormones every month, as the endometrium should do. When it does this, because it is not endometrium, because it's not the line of the uterus that's supposed to carry out this. If it is the uterus that's supposed to carry out this, you see the blood menstrual flow coming out from the vagina. But because it is not, and it is still reacting to hormones, there is no exit way for the blood to come out, and this will further lead to inflammation, pains, scars, and rest of them. And this particular endometriosis has no particular place it can occur. As I told you before, it is when the tissue that resembles the inner lining of the uterus, which is known as the womb on the endometrium, start growing outside the uterus. So if it grows outside the fallopian tube, it can grow outside the ovary, inside the ovary. It can grow inside the bowel, the intestine, even the bladder. So how do you know if you're having endometriosis and not the painful menstruation that you assume that you are having? First of all, if you're menstruating, you're going to be very, very, very painful. The pains is out of fear. Then secondly, you'll be having a very heavy blood flow and very long. If your normal menstrual period lasts for 5 days, this might last up to 10 days and more. And again, if you are changing only one pad a day, you can change up to 2 or 3 pads a day. This is the work of endometriosis. It can also cause pelvic pain. You'll be experiencing pelvic pain even when you are not menstruating. And another thing that you can see if you are having this endometriosis, it can lead to infertility, difficulty getting pregnant. The issue is that this endometriosis is underdiagnosed and millions of women are suffering from it. It is underdiagnosed because many assume that it is normal, because one of the major symptoms is severe menstrual pain. Please, if you are having severe menstrual pain, if you are having pain during meeting with your husband or with your partner, if you're having heavy flow, if you're having pelvic pain, go and meet your healthcare provider, meet your doctor, so that this endometriosis can be ruled out. Then if after the checkup and it is not endometriosis, then you can now continue living your normal life. But what if you are assuming that it is just a normal menstrual cramps and then it is endometriosis? Mind you, this can affect your quality of life and also affect your fertility. That's why it is necessary that when you're having these symptoms I have mentioned, that you rush back to your healthcare provider to ascertain they are not suffering from this endometriosis. Thank you so much for watching. Please follow, like, comment, and share. Goodbye.